What if I told you that 5 minutes of targeted touch each day could restore the firm, reliable erections you thought were gone forever? And I'm not talking about some tantric mysticism or uncomfortable procedures. I'm talking about specific, medically validated massage techniques that directly address the physical causes of erectile dysfunction in men over 60. Most men have no idea these techniques exist because doctors don't discuss them, and the pharmaceutical industry certainly doesn't want you knowing there are natural alternatives that actually work. I'm Dr. Julia, board-certified urologist with over 30 years helping men recover sexual function through evidence-based physical interventions. What I'm about to teach you goes beyond temporary fixes. These are techniques that rebuild erectile capacity by improving blood flow, releasing chronic tension, and reactivating nerve pathways that have gone dormant. Make sure you subscribe and turn on notifications because the protocols I share on this channel could transform your sexual confidence completely. Now, let me be direct about something before we go further. When I say massage, most men immediately think of relaxation or spa treatments. That's not what we're discussing here. Male wellness massage, specifically the techniques I'm going to teach you, are targeted physical therapy interventions designed to address the root physiological causes of erectile dysfunction. These aren't pleasurable indulgences, though they may feel good. They're strategic treatments that produce measurable improvements in erectile rigidity, stamina, and control. Here's what's really happening in your body that's causing weak or unreliable erections, and why targeted massage addresses these issues so effectively. As men age, 3 critical problems develop in the pelvic region. First, chronic muscle tension builds up in your pelvic floor, the network of muscles that controls erections, ejaculation, and urination. These muscles are supposed to contract and relax rhythmically, but years of stress, poor posture, and sedentary lifestyle cause them to stay chronically tight. When your pelvic floor is locked in tension, blood flow to your penis becomes restricted, nerve signals don't transmit properly, and erectile function suffers dramatically. Second, the smooth muscle tissue inside your penis itself, the corpus cavernosum chambers that fill with blood during erections, loses elasticity and responsiveness. This tissue needs regular stretching and stimulation to maintain its function. When it doesn't get that, it atrophies like any unused muscle. And third, the nerves that control erectile function, particularly the pudendal nerve, can become compressed, damaged, or simply understimulated to the point where they stop responding effectively to arousal signals from your brain. Traditional treatments for erectile dysfunction, pills like Viagra, only address blood flow temporarily. They force blood into your penis for a few hours without fixing any of the underlying muscle tension, tissue degradation, or nerve dysfunction. That's why the effects disappear as soon as the medication wears off. Male wellness massage, when done correctly with specific techniques I'm about to teach you, addresses all 3 root causes simultaneously. You're releasing muscle tension, stretching and stimulating erectile tissue, and reactivating nerve pathways. The improvements compound over time instead of disappearing when treatment stops. Let me walk you through the first technique, and this one specifically targets the pelvic floor muscles that most men don't even know exist until they start having erectile problems. This is called perineal massage, and it focuses on the perineum, that area between your scrotum and anus. This region is absolutely critical because it contains the root of your penis, major blood vessels, the pudendal nerve, and connections to your pelvic floor muscles. Most men carry enormous tension here without realizing it, and that tension is strangling their erectile function. Here's how to perform perineal massage correctly. Find a private, comfortable space where you won't be interrupted. Lie on your back with your knees bent and feet flat, or sit in a reclined position. Use a small amount of natural oil, coconut or olive oil work well, to reduce friction. Locate your perineum by feeling for the area between your testicles and anus. You're looking for a slightly raised ridge of tissue. Using your index and middle fingers, apply firm but comfortable pressure to this area. Start with gentle circular motions, maybe 30 seconds, just to familiarize yourself with the sensation. Then increase pressure gradually until you feel a dull, therapeutic ache, not sharp pain. If it's painful, you're pressing too hard. Once you've found the right pressure, Perform slow, deliberate circular massage for 3 to 5 minutes. You might notice tender spots or areas that feel particularly tight. Spend extra time on those areas, but maintain steady, comfortable pressure. What's happening physiologically during this massage is profound. You're directly stimulating the bulbospongiosus muscle, which helps trap blood in your penis during erections. You're releasing tension in the pelvic floor that's been restricting blood flow. You're increasing circulation to your prostate and surrounding erectile tissues. And you're activating the pudendal nerve, which carries sensation from your genitals and controls erectile reflexes. Men who perform this massage daily report several consistent changes. Within the first week, increased sensitivity in the genital area as nerves wake up. By week 2, morning erections often return or become significantly stronger. Within 3 to 4 weeks, erections during sexual activity become firmer and more sustainable. The key is consistency. This isn't a one-time fix. It's a daily practice that maintains and improves pelvic floor health over time. Now let's move to the second technique, which targets the penis itself and the smooth muscle tissue that determines your erectile capacity. This is called penile massage or sometimes rhythmic stretching, and it's based on the same principles physical therapists use for any tissue rehabilitation. Your erectile tissue, like any muscle or connective tissue, responds to regular stretching and stimulation by becoming more flexible, more responsive, and better able to fill with blood. Here's the protocol. In a warm, private environment, ensure you're in a semi-erect or flaccid state. Full erection isn't necessary and actually makes the technique less effective. Apply a small amount of lubricant or oil to your entire penis. Using your thumb and forefinger, create a ring around the base of your penis. With firm but gentle pressure, slowly stroke from base to tip, taking about 3 to 5 seconds for each stroke. The pressure should be enough that you feel a slight stretch in the tissue, but not so much that it's uncomfortable. Perform 15 to 20 of these strokes. Then, still maintaining that ring grip at the base, gently stretch your penis in different directions. Straight out, to the left, to the right, upward, and downward. Hold each stretch for about 10 seconds. The stretching isn't about increasing size, despite what you might have heard. It's about maintaining tissue elasticity and preventing the fibrosis that causes erectile tissue to become stiff and unresponsive. After the stretching, perform what's called the squeeze technique. Grip your penis firmly but comfortably at the base and squeeze in a pulsing rhythm for about 30 seconds. This pumps blood through the tissue and strengthens the smooth muscle response. The entire routine takes maybe 5 to 7 minutes, and when performed daily, it produces remarkable improvements in erectile function. Why does this work? You're mechanically stimulating the smooth muscle cells in your corpus cavernosum, which helps maintain their responsiveness to nitric oxide, the molecule that triggers erections. You're preventing fibrosis and maintaining tissue elasticity. You're improving local blood flow and circulation. And you're essentially training your erectile tissue to respond more readily to arousal signals. Physical therapists use nearly identical techniques for treating erectile dysfunction, and the clinical results are well documented. Men who perform these exercises consistently show improvements in erectile rigidity scores, increased penile blood flow on Doppler ultrasound, and better sexual satisfaction. Now, here's where I need you to take action. If you're serious about restoring your erectile function naturally and you're committed to trying these techniques daily for the next 30 days, type "restore" in the comments and let me know you're ready. Making this public commitment dramatically increases your follow-through, and I want to see how many men are willing to do the work instead of just looking for quick fixes. The third technique addresses something most men never consider: the connection between their lower back, their nervous system, and their erectile function. The nerves that control erections don't originate in your penis. They originate in your lumbar and sacral spine, the lower back region. When this area is tight, inflamed, or compressed, those nerve signals don't transmit properly, and erectile function suffers even if everything else is working correctly. Lower back massage for erectile health focuses on releasing tension in the muscles surrounding your spine, particularly the erector spinae muscles, the quadratus lumborum, and the gluteal muscles that connect to your pelvis. Here's how to perform this technique. Lie on your stomach on a comfortable but firm surface. You can do this on your bed if it's relatively firm, or on a yoga mat on the floor. Using a tennis ball or a specialized massage ball, place it under your lower back on one side of your spine, not directly on the spine itself, but in the muscle tissue about an inch to the side. Let your body weight create pressure on the ball. You should feel a deep, therapeutic pressure, possibly some discomfort, but not sharp pain. Slowly roll your body so the ball moves through the muscle tissue, searching for tight spots or trigger points. When you find a particularly tender area, pause and let the pressure release the tension for 30 to 60 seconds. Breathe deeply while you do this because deep breathing helps muscles release. Work both sides of your lower back, spending about 5 minutes total. Then move the ball to your gluteal muscles, your buttocks, which also connect directly to your pelvic floor. Use the same technique. Apply pressure, search for tight spots, and hold pressure on tender areas. This lower back release has immediate effects on erectile function for many men because you're literally decompressing the nerves that control erections. You're also releasing tension that radiates forward into your pelvic floor. Some men report feeling increased warmth or sensation in their genitals immediately after this massage as circulation and nerve function improve. The fourth technique is one that surprises most men but produces some of the most dramatic results. It's called abdominal massage, and it targets the area just above your pubic bone where major blood vessels that supply your penis are located. Most men carry significant tension in their lower abdomen without realizing it. This tension restricts blood flow to the pelvis and contributes to erectile dysfunction. Abdominal massage releases this tension while directly stimulating circulation to your erectile tissues. Here's the protocol. Lie on your back with your knees bent and feet flat. This relaxes your abdominal muscles. Place both hands on your lower abdomen, fingers pointing toward your feet, just above your pubic bone. Apply gentle pressure and slowly massage in clockwise circles. This follows the direction of your intestines and encourages lymphatic drainage. Start with light pressure for about a minute, just warming up the tissue. Then gradually increase pressure until you're pressing deeply into your abdomen. You might feel some tenderness, especially if you carry tension here. Focus on the area between your navel and pubic bone, using your fingertips to search for tight spots. When you find areas that feel particularly tense or tender, pause and maintain pressure for 30 seconds while breathing deeply. The total massage should take about 5 minutes. What you're accomplishing is releasing tension in your abdominal wall that's been compressing blood vessels, stimulating circulation to your pelvic organs including your prostate and erectile tissues, activating acupressure points that traditional medicine associates with sexual function, and creating a mind-body connection with an area most men ignore completely. Men often report feeling increased warmth spreading through their pelvis after this massage, which is literally improved blood flow. Now let's talk about frequency, timing, and realistic expectations because I want you to succeed with these techniques, not get discouraged by approaching them incorrectly. Ideally, you would perform all 4 massage techniques daily. That's roughly 20 to 25 minutes total. I know that might sound like a lot, but consider that men spend more time scrolling through their phones than that. This is an investment in your sexual function and masculine confidence. If daily practice feels overwhelming initially, start with the perineal massage and penile massage, which are the 2 most directly effective techniques. Do those for 2 weeks until they become routine, then add the lower back and abdominal massage. The best time is typically morning or before bed. Morning has the advantage of naturally higher testosterone levels, which can make the techniques more effective. Before bed allows you to be relaxed and unhurried. Some men prefer doing the techniques before sexual activity, which can enhance immediate performance. Experiment and find what works for your schedule and preferences. Regarding results, here's what's realistic based on clinical experience and research. Week 1. You'll likely notice increased sensitivity and awareness in your genital area. This is your nervous system waking up. Weeks 2 to 3. Morning erections typically improve in frequency and firmness. This indicates improved baseline erectile function. Month 1. Erections during sexual activity should become more reliable and sustainable. You'll likely notice reduced anxiety about performance because you're seeing physical improvements. Months 2 to 3. Most men report erectile function that's measurably better than before starting the techniques, often comparing it to how things worked 5 to 10 years earlier. This isn't instantaneous, and that's actually good. Quick fixes usually don't last. These techniques work by gradually rebuilding erectile capacity through consistent practice. Some important cautions and considerations before you start. If you have any acute pain, active infection, or recent injury in the pelvic area, consult a physician before trying these techniques. If you experience sharp pain during any of the massages, you're applying too much pressure. Back off immediately. These should create therapeutic discomfort at most, never acute pain. If you have prostate issues, particularly prostatitis or acute prostate infection, get medical clearance before performing perineal massage. The techniques are generally safe, but avoid them during active infection. If you're taking blood thinners or have clotting disorders, be gentle with pressure-based techniques to avoid bruising. And finally, these techniques complement but don't replace medical treatment for serious conditions. If you have diabetes, severe cardiovascular disease, or other health issues affecting erectile function, work with your doctor while using these as adjunct therapy. Now let's address the psychological component, because erectile function isn't purely physical. Many men develop performance anxiety after experiencing erectile difficulties. This anxiety creates a vicious cycle where worry about erections actually prevents erections by triggering stress responses that constrict blood vessels. These massage techniques help break that cycle in several ways. First, they give you something active to do instead of passively worrying. You're taking control and working toward improvement. Second, the physical improvements you'll notice reduce anxiety naturally because you have evidence that things are getting better. Third, the act of regularly touching and caring for your body in this intentional way rebuilds your connection with your sexuality and reduces shame or embarrassment. And fourth, if you're practicing these with a partner, which we'll discuss next, it creates intimacy and communication that reduces performance pressure. Speaking of partners, these techniques can be incorporated into intimate relationships in ways that enhance both physical function and emotional connection. If you're comfortable, you can teach your partner to perform some of these massages on you, particularly the lower back and abdominal massage. This creates vulnerability and trust that often deepens intimacy. You can also explain what you're doing and why, which opens communication about sexual health that many couples avoid. Most partners are relieved and supportive when they understand you're actively working on improvements rather than ignoring the problem or relying solely on medication. Some couples incorporate the massage into foreplay, using it as a way to enhance arousal while simultaneously supporting erectile function. The key is communication and mutual consent. Never pressure a partner to participate, but don't be afraid to share what you're learning and invite them into the process if they're interested. Now, let me address something that frustrates me as a physician. There's an entire industry of devices, supplements, and programs claiming to improve erectile function through various massage or exercise techniques. Most are overpriced and make exaggerated claims. The techniques I've shared are based on established principles of physical therapy and pelvic floor rehabilitation. You don't need to buy special equipment beyond maybe a massage ball for your lower back. You don't need expensive courses or complicated protocols. What you need is consistency, proper technique, and patience. Save your money and invest it in quality nutrition, exercise equipment, or medical care if needed. Don't fall for marketing that exploits your vulnerability about sexual performance. Let me give you a final practical framework for implementing this starting today. This week, commit to the perineal massage and penile massage techniques daily. Set a specific time, maybe right after your morning shower or before bed. Spend 5 minutes on perineal massage and 5 minutes on penile massage. That's 10 minutes total. Track how you feel each day. Notice any changes in sensation, morning erections, or overall awareness of your pelvic region. After 1 week of consistency, Add the lower back massage. You're now at 15 minutes daily. After 2 weeks, add abdominal massage for the full 25-minute routine. Continue for at least 60 days before fully evaluating results, though most men notice significant improvements much sooner. Remember, this isn't about perfection. If you miss a day, don't abandon the practice. Just resume the next day. Consistency over time produces results, not perfect daily adherence. These massage techniques represent something powerful: the recognition that your body can heal and improve when given proper care and attention. Erectile dysfunction doesn't have to be permanent or inevitable. You have more control over your sexual function than most doctors will tell you. The pharmaceutical industry has convinced men that pills are the only solution, but that's simply not true. Natural interventions like targeted massage, combined with proper nutrition, exercise, stress management, and healthy lifestyle choices, can restore erectile function without medication for many men. Even if you do need medication, these techniques often allow you to reduce dosage or use medication less frequently. With that said, thanks for watching, and I'll see you until next time.